this is for practical 3H18, ailments of the respiratory system. Okay, so first of all we're going to talk about some illnesses of the respiratory system, and the first one is chronic obstructive pulmonary disease. It's also known as heaves or broken wind. Now the main cause of this is when a horse is exposed to allergens and when they inhale them. So particularly when it's really dusty, or if a horse is constantly stabled with dusty type bedding, they're going to inhale that dust and they can develop reactions to it. Some of the symptoms of this include the horse may have altered breathing patterns to what you consider normal. The appetite may be affected in severe cases. Doesn't tolerate exercise very well. Maybe coughing, and in severe cases the horse may actually cough up yellow mucus. He'd have laboured breathing. He'd have possible high temps, but this is not always the case. And he has difficulty expirating his air. Okay, now the treatment and prevention for this, prevention's better than the cure. There's not a lot of medications, well there is, but you're better off being able to prevent it. So that would mean reducing or eliminating those allergens. Obviously sometimes it's not always possible as far as dust goes. But what you can do is, if the allergy is food related, you could change your food. If it's dust related, you water down your feed, you keep the horse on grass as much as possible, you'd soak the hay, and also you'd change any bedding used in the stable so that it would be one that consisted of less dust, to help that horse reduce the amount of allergens that it's inhaling. You can also get medications from the vet, but from what I've read, when you stop those treatments, the allergy will reoccur, so prevention's better than the cure in this case. Okay, the next respiratory illness we're going to talk about is roaring. Now roaring is caused when the larynx becomes partially or completely paralysed, and this is caused by the degeneration of the nerves that control the muscles operating the valve which opens and closes the larynx, and it's mainly down the left hand side lung of a horse. Now the symptoms of roaring is when the horse inhales, you'll hear a loud roaring noise. Now the possible treatments for this is you need to have diagnosis, so the vet will most likely do an endoscope, and depending on the severity of it, the horse may need to have surgery. However, most horses will be able to compete without needing surgery, and it's more common in race horses, I think. Excuse me. Okay, the next one we're going to talk about is pneumonia. Now pneumonia is an inflammation to the airways and is usually caused by bacterial infection. Fungi can also be caused by lungworms, or if a horse aspirates its food, so if the food goes down the airways into the lungs. Now symptoms of pneumonia, the horse may have fever, may be lethargic, it'd have a elevated heart rate, elevated respiration rate as well, be coughing, the horse would be depressed and lethargic, its breathing would be fast and shallow, because pneumonia affects the lungs and the airways. Okay, and so it may have nasal discharge and a cough as well. Now, treatment for pneumonia, a vet needs to administer medications for this because it can be quite severe, depending on the cause as well. If it's worms, you need to treat for worms, need antibiotics for the bacterial infection. And if there's any fungi, you'd need to eliminate that from the horse's environment as well, but you'd still need antibiotics regardless of what the cause would be in that case. Sorry. Now my next one we're going to talk about is strangles. Now strangles is caused by a bacterial infection. The bacteria is called Streptococcus equi. So it's very similar to the flu in humans as well. And it is highly contagious. Now symptoms can include a high temperature, the horse may have a poor appetite, now have hard swelling behind the lower jaw, have trouble swallowing, may have a high head carriage, and have a watery nasally discharge, and have a poor appetite. Now, treatment for strangles definitely requires a veterinary treatment, and given that it is highly contagious, you'd need to isolate the horse and quarantine to help prevent spreading it. And also, but this can be prevented through vaccine as well. So hopefully if you're vaccinated horses, you won't get strangles. However, if you do, you definitely need to seek veterinary treatment, antibiotics, and once the horse is recovered, then you'd need to go and get your vaccinations as well for that. Okay, now the next one we're going to talk about is equine influenza. A couple of years ago, all of my horses got equine influenza, so I've got a bit of first-hand experience with this one. Now, the cause of equine influenza is a very contagious virus. Now, when we had it a couple of years ago, it actually became airborne and became an epidemic across Australia. Sorry. Okay, your symptoms of your equine influenza, we have fever, the horse may have loss of appetite and may be a bit depressed, he'll be stiff and sore throughout his muscles, and his throat, if on touch, may be tender, he'll have an elevated heart rate and also respiratory rate as well, nasal discharge, he'd have a harsh dry cough, maybe coughing up green fluoro mucus, which is what my horses were doing. What else? So yeah, fever, elevated heart rate, horse would be lethargic, sore muscles. Okay, and that would be it. Now I think for treatment, as far as equine influenza goes, you definitely need to address your vet for that. Now, given that it is such a contagious virus as well, I remember we had the DPI out as well, so we had to inform them. And also quarantine the horses. We couldn't leave the property, and then also as far as prevention occurred as well, like it was airborne, but we'd also have to make sure we washed everything, all gloves, very, very high hygiene levels were needed. Now you're vetted and the DPI would confirm the diagnosis through blood tests. The horse would be given antibiotics, isolated from other horses, and just monitored to see how that fever goes and how they're recovering from their symptoms. I remember also we were given mucoprim for our horses as well, which is a powder that helps them clear up that mucus. Okay, so that's it for the ailments of the respiratory tract.